Hi, Dr. Sal Giorgiani here for Healthy Men, Healthy Family. Hope you're all doing well, and thanks for tuning in to another section of our program sponsored by Healthy Men Inc. at www.healthymen.org. Today, I'd like to talk about something topical, also very tragic, and that's the situation we saw in July of 2026 with Senator Lindsey Graham dying suddenly from cardiovascular disease and an aortic dissection, which means that the aorta, which is the main blood vessel that carries blood from the heart out to the rest of the body, sort of split open the way you might see in an inner tube. I want to point out a couple of things here that I think is relevant to all men. While this was a tragedy of immense significance in the political world as well as in the social world, this is a unfortunate scenario of lack of care by men for their health that plays out thousands and thousands of times every year for American men. Guys simply need to pay more attention to their health. And even though the healthcare system right now is not really guy friendly, which is one of the objectives for a Healthy Men Inc. organization is to make healthcare programs more guy friendly, you really do need to pay attention to your health. A couple of things I want to point about this scenario. First of all, it is good that Senator Graham knew his familial health. His father did have cardiovascular disease, but unfortunately, he didn't put that into action or make that part of his regular routine. Senator Graham had what many call gold plated health care. As a member of Congress and then in the Senate, he has health care paid for by tax dollars, and it is a very, very good health care plan that gives him access to virtually anything whenever he needs it. But he didn't take that advantage of that. And that's silly. You're buying it, you have it, why not utilize it? We don't know. We don't have a lot of records about his healthcare utilization, but everything I read online suggests that he, like so many men who have good healthcare coverage, just didn't utilize it for regular exams and follow ups and for treatment. The other thing is it points out the stigma of disease. Yeah, guys don't like to know that they're ill. They don't want people in their community and their families to know that they have a medical condition. They want to sort of like suck it up and take it like a guy, which is an unfortunate saying, and not talk about their health issues. And that's not particularly productive. For a fellow like a public figure like Senator Graham, anytime he would go in for a medical visit or for a diagnostic care, probably would have ended up being national news, maybe some sort of pithy news or unfortunate news or gotcha kind of news. But there are things in the unfortunate world of the media these days that probably made it very uncomfortable for him to think about going in for a regular exam or even a diagnostic series if something was picked up. That isn't just for high profile individuals like Senator Graham or movie stars or rock stars. It also is for the average Joe. Most guys do not want to be seen in the waiting room of their doctor's office. They think that people will look at them. They feel very self conscious about it. They don't go to employee health centers as frequently as they might be able to if those are available to them for the same reason. They don't want people to see them there. They don't want people to think that they're sick or they have a medical condition. And they certainly don't want their employer to know because they're as a concern. We see that a lot, particularly in the military. So guys, get over it. It's not a stigma that you can easily break, but it's something you've got to get over it. Just as taking your car into the shop doesn't mean your car is in bad shape. You've got to bring your body in for a medical exam regularly. He lived under a high stress environment. So many men, whether you're a blue collar worker or white collar worker or senior executive, there's a tremendous amount of stress. There are lifestyle issues associated with travel, with pushing the envelope, with running a million miles an hour and drinking from the old proverbial fire hose. That puts a lot of stress on you, both emotionally and physically. In Senator Graham's case, he had just flown back from the Ukraine. President Trump said when he spoke with him just the night before, he sounded very tired. And in and of itself, sounding tired isn't necessarily an indicator of an impending medical catastrophe, but it is something you need to monitor. And one of the ways that you monitor it is keeping tabs on your health over time. And that includes having medical visits over time so that your primary care physician can sort of keep a record of what you're feeling like and 5 years before and then compare it to what you're feeling like now. And it changes over time. Some of them are normal as we age and we age gracefully, some are not. Well, if you are a guy, you're in a big club where guys don't want to go to the doctor's office. Unfortunately, only 30% of men can identify a primary care provider, and that's far less than 70% of approximately 70% of women who can identify a primary care provider that they trust and that they go see regular basis. 60% of men would rather clean the toilet than go in for a medical visit. And unfortunately, men go in for regular medical visits, or at least annually, about 50% fewer times than women do, even if you exclude gynecologic sort of procedures. Don't be that guy. It's easy to manage, particularly if you have health insurance. And if you don't have health insurance, you might want to try and look into it, including Obamacare or other options, traditional care. If you don't have a primary care provider, you probably should go and get one, particularly as you get older, and take a page out of the Women's Health Playbook. Listen to your body. If you feel changes are occurring, don't ignore them. Get it checked. Healthy Men Inc. website, www.healthymen.org. We have a series of booklets called the Checkpoint series is some brochures that look at common tests you should be getting at various ages and stages in your life. We also have information there about recognizing signs of cardiovascular disease and heart attacks and stroke. We also have information there on vaccinations, and we also have information there about checkups, annual checkups for women based on particular ages and stages of lives, because women are, of course, an important part of the lives of men. So thanks for listening. If you have any questions or comments, or you'd like us to address a particular topic, please go onto our website at www.healthymen.org and drop us a line. Thanks for listening.